My name is Dan McDermott. We wound up at Gurwin because my father suffered a tragic fall approximately 2 months ago.
My name is Scott Gingold. I have been at Gurwin for almost 3 years. I came here because I had a tracheostomy and was put on a ventilator.
Gurwin is a healthcare system that sits on a 34-acre campus in Comac, New York. Really, the level of care here at Gurwin is that Tiffany level of quality, excellent clinical and environmental care. Our goal is to have great clinical outcomes. We're always looking for what can we be doing to improve the lives of our residents, and technology plays a key role in that. The vent population is a very tough one. People are tethered down by many machines, whether it be a ventilator, oxygen tanks, cough assist machines, nebulizers, suctioning them. All these things really make it burdensome on the person just for them to be able to function and breathe.
Because I come from the acute care background, and our ventilators tend to be bigger and more bulkier. And when I first heard about VOCSN, the concept of having everything together, I guess I would say a little skeptical. The integration of all 5 therapies in one makes a big difference. You no longer have to call up a durable medical equipment company to bring additional pieces of equipment if you need it, because everything now is all built in one.
We made a decision that we would pursue not just 1 or 2, but switching over our entire resident population to the VOCSN technology.
The transition to the VOCSN vents, I have to tell you, went very smoothly. And we did it very rapidly, which I was very happy to see.
My transition to VOCSN has been pretty smooth. After some minor setting adjustments, I am breathing more comfortably.
I think VOCSN will help us improve the care here because the vents are so portable, and it provides the suctioning, the nebulizer, the oxygen, so the residents actually can leave the unit and leave the facility with the vents, and everything is contained. The cough assist is a big plus. We've had patients who are on cough assist, which required us to get or rent a second machine just for that alone. So right now it's all contained in one system. So it makes the residents more mobile.
And with VOCSN, we believe with this technology, with the cough assist being readily available, with one touch of a button, we'll be able to mobilize the secretions from the lower respiratory tract. We hope to see less readmission to the hospital and the residents able to breathe more freely. Also, the RTs, it will make their lives a lot easier because they would no longer have to worry about bringing in another piece of device. One of the big features for us is being able to have that kind of integration.
48 hours after we started the transition, we had residents coming out of their room and enjoying TV together in the social area.
It's just make their lives a little bit more easier. They're on the speaking valve now more consistently, and before they were not. So just all in all, the quality of their lives have, I would say, improved tremendously.
Even in the short time they've put them up, I can just tell there's a big improvement. And anything that can assist, in his recovery is beneficial.
VOCSN is different from my old ventilator in that it's quieter, has a built-in cough assist, is completely digital, which makes changing and saving settings easier, and has a more efficient alarm system.
I haven't heard my dad's voice in almost 2 months. And now with this new system, with the ability to hear him talk and have a conversation instead of trying to read his lips, it's tremendous.
Our goal is to be able to allow them to experience and enjoy as much of the world that's out there, and VOCSN helps us do that.
I am looking forward to going outside more often since it's easier to transport with less equipment.
Technology is amazing, what it can do, and what it's doing for my father is great. It doesn't matter to me if he walks again. If he's in a wheelchair, that doesn't matter. If I could just sit next to my dad and watch a game, and he knows I'm next to him, it's all I need.